You are. I want to make sure we're using the right terms here. I don't want to say suffering. I don't want to say afflicted. How would you describe when people ask you, do you have Parkinson's disease? Do you say you're afflicted with? You are suffering from? How do you explain that to people? You're curious.
I have Parkinson's.
Bottom line.
Yeah, I have Parkinson's.
Yeah. You're living with.
Yes.
You're living with.
Yes.
We were just talking about medical marijuana. Was that a question or a discussion you ever had with the doctor?
No, never.
There's no curiosity because
no,
nothing at all.
Wouldn't consider it. No.
Your story, Linda. When did you realize that Parkinson's? Because we were talking about Parkinson's Awareness Month this month. When did you realize that something wasn't quite firing, wasn't quite working?
It was after my mother's death in a car accident. My left hand I had tremors in my left hand. And I went to the doctor and they said it could be just stress from the situation you've been through. Yeah. And come back in the fall. We'll check you out in the fall. This is June.
And what year?
In 1997. So I went back in the fall and they did a few tests and they ruled out this and that, and they decided that I definitely had Parkinson's. So it was.
Did you understand what that meant at the time?
Not really. I was the only one in the family that had ever been that had it.
Yeah.
Nobody else. No, it wasn't following a family situation. Nobody else had it. I was the only one. So I had to do some research, and I was really concerned about my future at that point.
And Richard, what did you think when this came up?
Actually, I hadn't met Linda at that time.
Oh.
So when we met, it was a few years later, and so Linda already had the Parkinson's.
Did you know much about Parkinson's before?
No, it was when we were dating that I did start doing a little bit of research, finding out more about the condition and what it really meant.
Smooth talker over here,
well,
right?
I made sure he knew about it. I was not going to pull any stops. I wanted to make sure he knew well in advance, and if he considered carrying on with the relationship, then that was he was full.
Boy.
And certainly knowledgeable of the situation.
Very honest of you, Linda. We have for you a video question, so we'd like you to take a look and to have a listen.
Hi, my name is Jed, and this question is for Linda. What were your first thoughts when you were first diagnosed with Parkinson's disease?
So that was back in 1999, as you were saying.
1997.
97, my apologies. Yeah. Your first thoughts?
I was concerned about how I was going to take care of my children. I was a single parent. I had one in high school, a 16-year-old in high school. I had a daughter in university. And how much longer can I work? How fast is this disease going to progress?
Yeah.
What does my future hold? I was terrified. But I started reading and I understood it more, and I decided I would do everything I could. And I just kept on going. I had to take care of my house and I had to take care of my children, and I just kept, I didn't think about it too much.
Yeah.
Tried to put it out of my mind and just go day to day, do what I had to do.
You're a fighter, Linda. I'm getting that impression from you.
Well, I wasn't giving in to it.
Good for you.
And somebody had to clean the house and cut the grass, so I kept doing it.
Yeah.
Well, how did your kids react?
They were worried. They were very worried. My daughter inquired of a friend of hers, had a nurse mother, so she immediately went to her and asked her a lot of questions. They educated themselves, so they were empathetic, but there wasn't a lot of. It didn't have a huge impact on me right then.
Sure. Well, so 1997 to where we are today in 2015. How have the symptoms progressed over the course of those years? To the point
where I was on a test. I was on a test at the university initially.
University of Calgary?
Yes, in Dr. Ranaway's department, because I was an early onset. I was only about 50 then, and I was young to have it.
Yeah, yeah.
So they put me on this test, and so I was taking medication or not. I didn't know
it was a clinical trial.
Yes, it was
a clinical trial. Yeah.
So I was on that for quite a while, and I wasn't taking very many pills. Eventually, I was taking maybe 3 a day or something like that.
What were some of your? Did you find? You said you mentioned a little shaking.
Well, I couldn't. My writing changed. I used to have nice script.
Yes.
And I couldn't write. My writing was much smaller, and I couldn't. It was hard to read. It's hard to write, and my voice softened. people would say, I can't hear you, speak up.
Yeah.
Can't hear you on the phone. So it made my job difficult. So I eventually had to give up my job and I went on disability. So I was home. I couldn't handle the job.
I bet. Yeah.
Yeah.
These lights are hot, aren't they?
Yes.
Yeah.
Yes.
Well, we're going to take a break in
Yeah.
just a few moments, and thank you very much for being so candid, because there's such a curiosity. The only real, sometimes people would say, the introduction that we've had to Parkinson's or someone with is, of course, the actor Michael J. Fox, who is a fighter as well too. You've got a lot of similarities with that gentleman as well too. Have you ever had the chance to meet him, or
No,
would you
no.
ever want the chance to meet this
Oh,
gentleman?
certainly.
What kind of questions would you ask him?
How do you? I have his book, and I've read an article in the Reader's Digest about him,
Yeah.
and he's been in various magazines. He's had articles. My friends have made sure I've seen them, so I've read up quite a bit about. He's a fighter. He just goes on as if he takes care of his
Normal
children.
everyday life.
Yes.
Yeah.
I think that's what you have to do.
Well, one of the things you're doing as well too, you're surrounding yourself with very smart and sexy people.
He's wonderful. He takes care of me when I'm not coping. He's there for me, and that's important.
Yeah.
It really helps a lot.
Have you tried to live as normally as possible?
Yes.
Yeah.
Yes. I have.
We notice you've got a few movements.
Yes.
So things have progressed a little bit. So it's the shoulder, the leg. Again, for somebody who is not too familiar, we'll ask more from the doctor, but yourself, what kind of daily battles are you facing?
Well, I guess fatigue. I used to be in real trouble, but this new program that I have, this new treatment, is helped me a lot. I'm not falling as much as I used to. I used to fall probably 20 times a day. I had bruises on my elbows. I wore knee pads, and I was using a cane for stability. And
Right.
I don't need the cane, and I don't wear the knee pads anymore because I'm much more able.
Good for
Because
you.
I have medication right straight through. I don't have the dips and valleys that I had before.
Right.
You take a pill and it's good for a while, and then it drops off.
Yeah.
So then you drop off. Your energy levels drops, and you just go into slow-mo.
I bet your diet has changed somewhat too.
Not much.
Not much. Well, you know one thing might help? Poutine. I'm telling you right now, it is a revolutionary new drug, Doctor. You back me up on this one.
Yes.
And it's so tasty, so yummy.
Yeah, I
Trust
know,
me,
I
we'll
know.
talk more about poutine with you, Linda.